Dogs bring us joy, companionship, and unconditional love, but there's a silent and deadly threat that could be lurking inside them: heartworm disease. What is it? How does it affect our furry friends? And how can we protect them? Let's break it down. Heartworm disease is a serious and potentially fatal disease in pets in the United States and many other parts of the world. It is caused by foot-long worms that live in the heart, lungs, and associated blood vessels of affected pets, causing severe lung disease, heart failure, and damage to other organs in the body. Heartworm disease is caused by Dirofilaria imitatus, a parasitic worm transmitted through mosquito bites. The mosquito deposits larvae subcutaneously just beneath the skin, where they begin their journey through the bloodstream. Over several months, these microscopic invaders mature, reaching up to a foot long in length inside the heart and lungs. The primary organs affected are the heart, lungs, and pulmonary arteries, which transport blood from the heart to the lungs. As the worms grow, they clog the vessels, making it difficult for the heart to pump blood effectively. As the worms grow, they cause vasoconstriction, narrowing blood vessels and making it harder for the heart to pump efficiently. Over time, this leads to congestion, edema, fluid buildup, and heart failure. Heartworm disease is a chronic condition because it develops slowly over time. Dogs may not show signs for months or even years, but as the worms multiply, the damage worsens, leading to heart failure and lung disease. Heartworm disease is found in all 50 U.S. states and is potentially fatal if untreated. It can cause severe lung disease, heart failure, and even metastatic bacterial infection. The good news is it's completely preventable with monthly medication or annual injections. Despite this, thousands of dogs suffer from this disease every year due to misprevention. Why is heartworm important to discuss? Mosquitoes spread heartworms when they feed off an infected animal and then bite a new host. An infected dog may have decreased appetite and weight loss. Many flea and tick treatments repel mosquitoes. Early on, dogs may show no symptoms, but as the disease progresses, signs include mild coughing, fatigue after exercise, weight loss, swollen belly due to heart failure. In serious cases, dogs can experience a life-threatening blockage called cavinal syndrome, leading to sudden collapse. In early stages, the heart tries to compensate by pumping harder to maintain circulation, and the immune system attempts to fight the parasites. However, as the worms multiply, these adaptations fail, leading to congestive heart failure. At first, the body compensates by vasodilating blood vessels to maintain circulation. The immune system attempts to respond, sometimes leading to pyodermia, a bacterial infection, as the dog's body fights systematic inflammation. However, as worms multiply, these coping mechanisms fail, leading to organ damage and respiratory distress. Vets use a blood test to detect heartworm proteins. Additional tests like X-rays or ultrasound may be used to assess the extent of heart and lung damage. A positive test confirms the presence of worms, requiring immediate intervention. If positive, additional tests like X-rays or ultrasounds help assess the extent of granulation tissue buildup, and heart enlargement. If left untreated, heartworm disease becomes mal- malignant, progressively worsening and leading to fatal complications. Heartworm disease is devastating, but it is completely preventable. A simply monthly pill or annual injection can protect your dog from this deadly pesticide. Talk to your veterinarian today because prevention is always better than treatment.